from the day that I almost had an accident. I couldn't go outside anymore because of my fear from the cars. But that was only the first stage of my trauma, and day after day it got worse, and now other things also trigger my fear. I have endless nightmares every night, which reminds me of my terrible memory. This has caused me sleep difficulties and feeling detached from others.
The condition that this patient is experiencing is known as post-traumatic stress disorder, or PTSD. PTSD may develop after a person is exposed to one or more traumatic events in their life, such as sexual assault, a serious injury, or threat of death.
The diagnosis may be given when a group of symptoms such as disturbing recurring flashbacks, avoidance or numbing of the memories of the event, and hyperarousal continue for more than a month after the traumatic event.
Most people who experience a traumatic event in their life don't develop PTSD. Women are more likely to experience a higher impact events compared to men, and therefore they are more likely to develop PTSD.
Now about the children, they are less likely to experience such a disease after trauma than adults, and especially if they have less than 10 years of age.
To see how the feedback loop of PTSD works. Stress factors lower the cortisol levels in our body, which this is the reason that PTSD patients are a lot different from normal people.
How does this happen?
Well, a stress factor will have an effect on hypothalamus, which causes it to send a corticotropin releasing factor to anterior pituitary. Anterior pituitary then releases corticotropin to adrenal cortex, which this process makes it to release cortisol. In patients with PTSD, however, the released cortisol would have a negative feedback on both hypothalamus and anterior pituitary. This HPA axis...
Excuse me, what is HPA?
Well, HPA stands for hypothalamic pituitary adrenal axis. So as I was saying, this HPA axis alteration contrasts with the well-known chronic stress cascade in which corticotropin releasing factor release results in an erosion of negative feedback and downregulation of glucocorticoid receptors. Urinary and plasma cortisol levels are considerably lower in PTSD patients than in non-PTSD trauma survivors and normal controls. What was PTSD again?
PTSD is a mental health condition that is triggered by a terrifying event, either experiencing it or witnessing it.
Symptoms may include flashbacks, nightmares, and uncontrollable thoughts of the event.
These symptoms cause significant problems in work or social and also in relationships.